Mutually Beneficial Partnership, Lessons from to Research Practice Partnership Projects conference call. Today's conference is being recorded. At this time, I'd like to turn the conference over to Ms. Ellen Simons. Please go ahead.
Thank you so much, and hello everyone. Welcome to the Mutually Beneficial Partnerships, Lessons from Two Research Practice Partnership Projects webinar, co-hosted by the Office of Planning, Research, and Evaluation's Self-Sufficiency Research Clearinghouse and Health Profession Opportunity Grants University Partnership Initiatives. I'd like to thank you for joining us today and go over some housekeeping remarks. First, the audio for today's webinar will be broadcast through your computer speakers. Please make sure that the volume on your computer speakers is turned up so that you can hear the presentation. Background materials for today's webinar are available for you to download from the pod in the top right corner of your screen, designated with the word Files. Please click the name of the file you wish to view and then the download button to open or save a copy of the material to your computer. We will be taking questions at the end of the presentation, but we encourage you to submit any questions that you have throughout the webinar. To do this, find the question and answer pod designated by the letters Q&A in the bottom right portion of your screen. Type your question into the open field at the bottom and then click the Send Question button or Enter. In the coming weeks, a recording of this presentation, the slides, a transcript, and a question and answer document will be posted to the SSRC, and an email notification will be sent out to you when these materials are posted. This webinar will feature Dr. Janet Boguslaw and Dr. Philip Hong. Before we give them the floor, I will provide a brief overview of the Self-Sufficiency Research Clearinghouse, and then Hillary Forrester will provide an overview of OPRE's Health Profession Opportunity Grants Research and Evaluation Portfolio. The Self-Sufficiency Research Clearinghouse, or SSRC for short, is a virtual library of research and resources on programs and policies designed to improve the self-sufficiency of low-income individuals and families. The goal of the SSRC includes facilitating communication between researchers and practitioners, increasing awareness and use of self-sufficiency research, and improving practice and program implementation for low-income families. Today's webinar is right on target with the goals of the SSRC. Partnerships between researchers and practitioners are critical for generating high-quality self-sufficiency research and using research to inform practice. Another SSRC goal is to foster professional connections, so we are delighted to offer this opportunity for all of you to hear from Dr. Boguslaw and Dr. Hong, and to share your thoughts, questions, and experiences during the discussion period. The SSRC has over 2,000 items in the library, and it's growing steadily. The library records are currently being updated, and you may notice that some resources you try to access are temporarily unavailable. Please email us if you need research that you're not able to access at the email address on this slide. The SSRC is designed for researchers, practitioners, and policy makers, and includes interactive features, such as events and conferences listed on the homepage and the ability to submit events and learn more about events in the field. The Make a Linkage feature allows users to connect with organizations and stakeholders in the self-sufficiency field. And the Data Sets and Data Sources section provides information on varied databases with links to sources to obtain the data. The substantive focus of the SSRC addresses 12 topics shown here, as each relates to self-sufficiency. Hopefully these resources will be of use to you in your daily work, so please visit the SSRC and let us know what you think. Now I'll turn the floor over to Hillary Forrester.
Great, thank you, Ellen. I'm Hillary Forrester with the Office of Planning, Research, and Evaluation within the Administration for Children and Families. I serve as a federal project officer for several of the research projects we have underway on the Health Profession Opportunity Grants program, or as we call it, the HPOG program. I'd like to thank the SSRC for hosting this webinar today and highlighting some of the research we have on HPOG. And I encourage everyone to check out the SSRC website and all of the great resources and research they have available. So I'm just going to provide a very brief overview of the HPOG program and of OPRE's research and evaluation portfolio for HPOG before turning it over to our two main presenters. So the HPOG program was established by the Affordable Care Act of 2010 to set up demonstration projects to provide training, education, and supportive services to prepare TANF recipients and other low-income individuals to enter and advance in the healthcare sector. In 2010, the Administration for Children and Families awarded 5-year grants to 32 grantees across 23 states, including 5 tribal grantees. There's great diversity across the HPOG grantees. They vary across a number of characteristics, including type of lead organization, location, program size, and the range of occupational fields for which training is provided. However, they all carry out their projects in coordination with a number of partners, such as the state TANF agency, relevant local and state workforce investment boards, and state apprenticeship agencies, and all use a career pathways approach, which means that training is organized as a series of manageable steps leading to successively higher credentials and employment opportunities. ACF has made a significant investment in research and evaluation around the HPOG program in order to understand program implementation, systems change, outcomes, and impacts. OPRE has a multi-pronged research strategy to begin answering some of these questions. And you'll see on your screen the different components that are included in this research strategy. Today, 2 of the HPOG University Partnership Research Grantees will be discussing with you how they facilitated research and program partnerships. The University Partnership Research Grants for HPOG are intended to complement OPRE's overall research and evaluation portfolio for HPOG by providing an opportunity to examine and answer specific questions of interest in particular HPOG programs. Each University Partnership Research Grantee had to partner with an HPOG program or programs as an integral part of the research plan development and execution. The aim is to conduct research that will inform and improve HPOG program performance. So today, the 2 presenters joining us are Dr. Janet Boguslaw and Dr. Philip Hong. Dr. Janet Boguslaw is Associate Director of the Institute on Assets and Social Policy at the Heller School for Social Policy and Management at Brandeis University. She is also Associate Director of the Heller School's Masters in Public Policy program and directs the Concentration in Poverty Alleviation. Her work focuses on building the assets and well-being of vulnerable populations through multi-stakeholder initiatives. We also have Dr. Philip Hong with us. He is Associate Professor in the School of Social Work at Loyola University Chicago and a Faculty Associate of the Center for Social Development at Washington University in St. Louis. His main academic interest is in poverty and workforce development. And with that, I will turn it over to Janet.
Great, thanks Hillary, and good afternoon everyone. Our study is focusing on the employment, retention, and advancement opportunities for racial, ethnic, and linguistic minorities in New Hampshire. So for today's discussion, I'd like to focus on 3 key areas. First, I want to introduce our research, the partnership, and why this is a new approach to the Workforce Development Initiative. Then I want to discuss some of the key elements of the partnership, how we work together, and move some of the work forward together. Finally, I want to provide some examples of how the research has been shared and developed with the program and look at some of its shorter and longer term impacts for the self-sufficiency of the healthcare workforce. So let's start with the partnership. This is a partnership developed between researchers at ISP and the program staff at OMRA. ISP is a research institute. We conduct research and engage constituencies to shape a fresh understanding of strategies for poverty alleviation and work to develop policies and practices that build the security, stability, and well-being of those who've been left out of the economic mainstream. The Health Professions Opportunity Project, HPOP, is located within the New Hampshire Office of Minority Health and Refugee Assistance. We work closely with the director of OMRA as well as with the HPOP project director and her staff. So what is the context for our research? First is changing demographics. HPOP has set a goal to train 1,000 individuals, seeking to train at least 25% from the minority population. New Hampshire has traditionally had a very homogeneous population, but that is changing. A few facts here to get us started. The state's minority population accounted for almost 30% of the state's population growth from 2000 to 2008. Diversity in New Hampshire is spatially concentrated in metro areas in the southern part of the state, 18% in Manchester, 21% in Nashua, for example. Diversity is growing among the youngest residents. New Hampshire's Latino youth population grew almost 53% from 2000 to 2008. And nearly 25% of New Hampshire's African American population lives below the federal poverty line, as does 16% of the Latino population and 18% of the American Indian population. Almost 20% of all other minority populations in the state are poor, compared with only 7% of New Hampshire's white residents. Over the past 20 years, New Hampshire's been a refugee resettlement state and has contributed to New Hampshire's changing demographics. Among the refugees are a wide range of professional and educational backgrounds. The second context for this work is that the New Hampshire healthcare workforce does not reflect the patient population, nor the workforce pipeline and training. A 2008 report of New Hampshire hospitals indicates that only 4% are minority workers. The majority of the diverse workforce is concentrated in low-level positions, indicating few opportunities for advancement. There is concern that not only does the current workforce not reflect the patient population in the most diverse areas of the state, but that with the growing demographic changes, health disparities that currently exist will grow if attention is not given to building a pipeline of experienced workers. Finally, and this is across the board, all low-income participants are eager to get to work. They want to start work and pursue additional training after they're working, but the challenges of healthcare shift work often make continuing training and education a challenge. So we have developed a few baseline research assumptions with our partners, and this helped underlie the research and provided our theory of change. We decided the focus of the project would not be on the workers themselves as the primary focus, but on the employer organizations to understand the barriers and opportunities for increasing the hiring, retention, and advancement of minority workers who have not been part of the professional staff in New Hampshire's healthcare organizations. The primary assumption is that a diverse workforce is beneficial to the healthcare organization and that it will provide opportunities for greater self-sufficiency within the community by providing good jobs with benefits and career advancement opportunities to those who previously have been left out of the employment and healthcare sector, and by improving overall community health by reducing health disparities, which will enable people to be more productive and be able to sustain employment over time. So that is the sort of self-sufficiency model. The research initiative is shaped by three questions. How can New Hampshire healthcare employers create a more diverse workforce and foster greater recruitment, retention, and advancement of racial, ethnic, and linguistic minorities? How can the workforce development field, learning from employers, better prepare and support both workers and employers in the healthcare sector? And finally, what are the opportunity structures or bridges that need to be developed or leveraged to build and sustain a more diverse and upwardly mobile workforce in New Hampshire? This is primarily a qualitative research initiative designed to have short-term in-process impacts through HPOP and to set in motion long-term learning and processes that will be sustainable and grow in impact well beyond this project funding. The key objectives were and are to identify barriers, understand the strategies that make some healthcare employers successful in this area, create new knowledge that has impact for the workforce development system, and create new knowledge and resources to engage employers in this work. Over the past 2 years, we've conducted interviews with New Hampshire healthcare employers, healthcare workers, healthcare association and foundation leadership, community leaders, providers of healthcare training, both public and private, and job and career developers or counselors connected to these education and training programs. We included hospitals, long-term care facilities, home health care agencies, community health centers, and many others, focusing on the geographic area. 2 quick findings to date in general. One is that current practices and strategies within the workplace do not fully support minority hiring, retention, and advancement, and we've surfaced a lot of the barriers that are presenting. And that the workforce development system does not sufficiently integrate the communication, teamwork, and cultural competency skills employers seek within the technical skill training and education programs. So, this is a unique partnership. That was the context for it. This is a unique partnership because it is between a statewide agency and a university that's based outside of the state. What are the advantages? At least 4. First, research needs to be locally developed and created, and that requires access. Healthcare employers are most responsive initially to what they learn from and about their peers in the context of their state. OMRA drew on its many networks to get ISP connected to enable interviews and other data gathering. And OMRA knows other research based in New Hampshire around workforce development and healthcare, so it's able to help limit overlap and to avoid employer fatigue when seeking access to data. Second, to make research productive requires an actively engaged local partner who has reach and access to key local, regional, state stakeholders. Geography plays a critical role in developing this work, and New Hampshire is primarily a rural state with a few key cities. Stakeholders largely know each other, and attempted interventions happen in a fairly transparent way. OMRA can advance its work through its multiple channels. Third, research findings need to be prioritized, and ownership and responsibility for moving different components forward must be owned in the state to be sustainable and have impact. ISP reviews findings with OMRA to identify and strategize about its importance, value, and then facilitates meetings with employers and workforce development players to vet the information and help develop broadly owned agendas. Finally, we've heard repeatedly that research conducted by the university brings a sense of neutrality, validation, and reliability about the findings. Being out of state means ISP is not perceived as one of the state's stakeholders, and there seems to be fewer concerns about confidentiality, prioritization of findings, or self-interest. A variety of strategies have helped us develop and maintain the partnership over time. As you can see on this slide, we've built in opportunities to connect at regular meetings, in person, by phone, and to share the delivery of presentations about our work together. And just to be transparent, we worked together on developing this presentation for you today. One of the other things that was really valuable is that we have some semi-shared staff. Our lead graduate research assistant on the project previously was a full-time employee at OMRA and remains on their staff for a few hours a week. She serves as a liaison between the partners, helping to provide historical context, improves communication, and helps strategize about how the research can best be made productive because she knows the communities well. Now I want to talk about the partnership environment and the research impact to date. I'll focus on 4 areas. One is process, the second is capacity building, the third about content and data, and fourth, sustainability. So first, process. This research is secondary to HPOP's primary mission, which is focused on enrollment, training, and placement of participants. The research is intended to help advance this work, but the question is how? From our research, we've been able to break out some of the short and long-term strategies. What does this look like? For the shorter term, for example, we've been able to raise awareness among job developers about how to frame minority difference as a benefit to employers, broadening the discussions of how an individual might bring value to an organization beyond just the technical skills they hold. With a number of findings that could be put into action, HPOP has dedicated a portion of the time of a new staff hire to advancing this work, building its own capacity to move the research forward. Finally, the research has implications for training providers broadly. So HPOP has been able to bring information forward to some of its key partners in education and training to have them move findings forward, move the responsibility and ownership to others whose work will benefit HPOP participants. Good examples of this are building more cultural competency training and work readiness into the core skills training programs offered through community colleges. The research is designed to impact the work of our HPOP partners, but the findings suggest that the work that needs to occur is institutional change within the healthcare provider organizations and the workforce training and education provider programs. HPOP has to find a way to leverage the findings to influence the work and capacity of others. This takes time, education, and resources, all of which we as researchers bring to the table. Some examples here. ISP has contributed to 2 surveys, one conducted of employers by the community college system and one by the Southern New Hampshire Area Health and Education Consortium of minority nursing students. We have helped to add questions that would surface information that can improve minority hiring and retention and be part of another institution's ongoing work. We presented our findings and engaged discussion around it with the HPOP employment team, the New Hampshire Workforce Diversity Committee of the New Hampshire Health and Equity Partnership, with the New Hampshire Research and Evaluation Group, at state workforce conferences, and to a steering committee made up of Healthcare Employer Association leadership. We have also encouraged HPOP to examine its own data on minority participants to share with employers about the strengths and skills of those they are training for the pipeline, and to use the data to increase outreach through community engagement to bring members of all minority communities into the training. Finally, we've been starting to co-brand work with others in the state to increase the reach of the data we are producing. So here's an example of some of the concrete outcomes. This was developed from the project literature review, turned into a document for employers. It was co-produced with OMRA, ISP, and the New Hampshire Health and Equity Partnership. It has been widely distributed, and it's actually there in the corner box on your screen if you want to download it. Other ways that the research has started to contribute. We brought findings to inform the development of the website, which has a section for business and employers with a subsection on diversity. We've surfaced concerns among minority workers about job search strategies, making job developers aware of the challenges workers are facing. Through regular attendance, we bring information to the business advisory committees in each region, raising issues such as how employers can broaden their job descriptions to make them more reflective of the values and needs for diversity, shifting their lens about what is valuable to the organization, bringing diversity mission statements in for review and discussion, talking about how they are being used as tools to build leadership and change organizational cultures. The research, as noted earlier, has helped change up the content of some of the training initiatives funded through HPOP. And where change has not yet happened, it has opened up discussion. One area under development is improving what participants know and understand about their rights and responsibilities in the workplace, empowering them to understand how to advocate for themselves and use HR offices. Ideally, this will improve retention of minority workers and help them navigate career advancement. We have surfaced new research needs that go beyond this project, with many of HPOP's other partners in New Hampshire now thinking about how research might help them move their own work in this area forward, consulting with us about how to advance their work. And this is an example of the nice HPOP website that's been developed, and you can see in the corner there that there's a section for businesses and employers, and within that there's a section on diversity. Finally, sometime soon the HPOP program will end, as will our research partnership. An important goal is to make sure the research leads to action that is embedded in the ongoing work of state actors. New Hampshire has many groups working on developing the pipeline, and our research initiative has been connecting with all of them. So to sum up, the partnership has helped HPOP and OMRA incorporate new analyses of the problems and identify what kinds of new data will help them achieve their goals. 3 final points here. First, creating a healthcare workforce is not the sole responsibility of workforce development professionals, nor the workforce itself. It requires a focus on the education and training, not just on the supply side, the workforce, but the demand side, employers as well. Data needs to be continuously gathered that identifies and addresses workplace barriers to employment for low-income minority workers. The HPOP staff know more now about what to ask workers and employers about the employment environment, and they are building such questions and engagement into their work. Second, employer education is critical to workforce success. Employers do not understand the difference between developing a culturally competent staff and developing a culturally effective organization. Surfacing these kinds of analyses will help OMRA and HPOP take the lead in working with employers to build the opportunity structures and bridge the gaps that make minority hiring a win for the organization, employees, and the community. HPOP and OMRA have set as a goal building closer connections and partnerships with employer associations and employers to advance this work through business advisory councils and other venues. They have the data they need to move this work forward. Finally, you have to identify and lift up the promising practices. We helped, and they want to continue to seek out and highlight models that can be shared with other employers from common sectors and community leaders, demonstrating that New Hampshire employers can and do embrace diversity as a strategy that helps with their bottom line. HPOP and OMRA staff now have several good models, examples to point to, and they are more likely to seek these out to highlight in the future. So this is my rough cut map that we've been putting together. When you look at the partnership model, it's generating short-term information that is valuable to the HPOP participants by helping raise employer awareness, make changes in the education training system, and by building bridges and communication systems that will endure beyond the project. Ideally, this will improve the environment and opportunities for low-income minority workers to gain employment in the healthcare sector, improving their incomes and career opportunities over the long term, while simultaneously helping reduce healthcare disparities within minority communities. The mock-up of the system is not yet complete, but it begins to create a picture of how the research can help drive new partnerships, improve communication, and help drive changes in organizational practices. As you can see, this is a very applied project. We seek to engage multiple sectors in new ways, all to help advance self-sufficiency, strengthening individuals, families, the healthcare employment sector, and the communities. We have a new report that will be coming out at the end of the month, and if you'd like to receive it, just send us your name and we'll put you on our list. Any of us would be happy to talk to you more about the partnership or about the work and research that we've been developing. So thank you very much for your time and attention.
Thank you, Janet. As a reminder, please submit any questions you have through the Q&A. And now we'll turn it over to Dr. Philip Hong.
Thank you, Janet, for a wonderful presentation. My name is Philip Hong, and I'll be presenting to you our project that we partner with two HPOC organizations. And I'll provide you with a little diagram here that when we look at the process of welfare reform, when it was first argued and it was implemented, we have poverty as our problem issue, and the main source of the issue was welfare dependency, and we have located psychological barriers as the main source of the dependency problem that has been causing poverty for long-term welfare users. And we have seen over the as welfare reform has been progressing, as we have seen economic security and financial stability as a positive term to replace poverty, and seen economic self-sufficiency to replace welfare dependency. And we have seen the logic where welfare work preparation and participation through human capital development and labor force attachment as a practice that would have some bearing on addressing the issue of psychological barriers as a key source of the problem of welfare dependency that eventually, in the long term, causes the cycle of poverty. So with that logic, the problem definition, we, as researchers, we were wondering how to address the gap where there is, that the logic of participating in job preparation and work participation leads one to be psychologically self-sufficient or develop confidence in moving through the job as they develop as a job workers. So we have deliberately wanted to look at what happens when someone transitions from welfare to work. How does that psychological barrier one experiences, are they overcome as they move into the path of economic self-sufficiency in the long term, reaching economic security and financial stability? So we wanted to look at target psychological self-sufficiency as a direct comparable to psychological barriers and not assume that work preparation and participation would directly link someone's self-confidence building or self-esteem building, or some have termed this soft skills, non-cognitive skills, that people who work in the workforce development field understand as core to learning and training and being work ready. So that's the motivation for the university partner research that I wanted to present to you. And this part that that you see in the circle is where we want to focus on how psychological self-sufficiency contribute to economic self-sufficiency. In the long term, we would want to see also their placement and retention outcome as they move through the career pathways. So the purpose of our research that we presented to our HPOC partners were twofold. First, we wanted to validate the measure of psychological self-sufficiency that comprises employment hope and perceived employment barriers. And one would wonder how we came about defining psychological self-sufficiency in this manner. And this is through our series of qualitative focus groups analysis that we were able to generate data to define self-sufficiency from bottom up as defined by participants in workforce development programs and also staff that manage these programs to bring the components together to define self-sufficiency as a process that would lead to an outcome of economic self-sufficiency. So that's where everything began, and now we have measures that we intend to validate with the study, and also wanted to validate the extent to which psychological self-sufficiency affects economic self-sufficiency as one goes through the HPOC programs. I'd like to highlight the theory of change of the overall HPOC program, that where you see at the end goal is the job outcome and retention in health careers. And the program component in the beginning, if you see the first block, education and training in health career pathways, and that coupled with that, you would see supported services and program that supports program completion of students participating in the HPOC program. And comparable to these blocks, if you talk to, when we had a meeting, series of meetings with our HPOC partners in the beginning, they saw the economic self-sufficiency as their own end goal through these comparable blocks that represented by career goals, resource skills, and motivation that's comparable to education and training. So that's at the individual student level. What would be the change that would happen as a result of participating in these education and training programs? They would develop career goals, utilize resources and skills, and develop motivation. Also, you would see in the second block the barriers they would overcome as they become job ready is sort of the process component as they go through the HPOG training program and eventually reach economic self-sufficiency. And just to give you a quick glance at the two HPOG sites that we are referring to. The first site is Gateway Technical College, located in Kenosha, Wisconsin, with 4 campuses at Elkhorn, Burlington, and Racine and Kenosha. The 4 campuses work together to train approximately 60 students annually to enter and advance in healthcare sector positions, and they target skills and competencies demanded by the healthcare industry and support career pathways. They also strive to support acquiring certificates and degrees in employer industry recognized areas, and they combine supportive services with education and training, and that's the part that we are very much interested in when we first had our discussion with the partner. To what extent these support services are provided, and what is the nature of these support services that empower individuals as they go through the career pathways. And also, they provide training services at times and locations that are kind of widespread up in the southern Wisconsin, in Kenosha, Racine, and Burlington, Elkhorn, 4 campuses of the school, the university. And the Southland Healthcare Forum is the second HPOG site, and their main purpose is to increase the number of qualified medical assistants, licensed practical nurses to meet high-demand healthcare occupational needs in the region. This is actually located in Chicago Heights, Illinois, a little bit south of Chicago, and they enroll approximately 75 students annually, and through various support services, and also providing direct training in-house, and also they outsource their training to the local community college, Prairie State Community College, and Khan Academy, and so forth. So they partner with other community resources to provide services, particularly focusing, they have a heightened vision to provide support services, number 4, in ways that would help individuals become strong students, not just to complete the program, but hopefully in hopes that they would do well out in the job market. So they are both programs. When we met together, we shared the vision with the university partner that we are focusing on the human development nature of our education and training through career pathways in healthcare. So that's how we came together to, if you see the bottom, that represents the university theory of change, and that connects well corresponding to the HPOG program theory of change. And if you were to look at the bottom half, the first block, goal-oriented pathway, corresponding with the career goals, resource skills, and motivation. And the second block, psychological empowerment, corresponding with overcoming barriers and work readiness. And these 2 blocks in the bottom, where you see the arrow going from goal-oriented pathway to for psychological empowerment, those are the 2 components that make up the concept of employment hope. And we see the changes of employment, we hypothesize that the changes in employment hope, as they either sustain or improve, help overcome some of the perceived barriers that they encounter as they move through the career pathways toward economic self-sufficiency. So the common denominator for both of us coming together in partnership for the university partner and the HPOG partners, we share that economic self-sufficiency is the outcome that we both want to look at, but we are also sharing the process that it takes for one to become economic self-sufficiency as they launch their journey toward a healthcare career. So what is being evaluated? As mentioned, we are looking at the process of psychological self-sufficiency change, and that comprises employment hope and perceived barriers, and how that ultimately leads to economic self-sufficiency as students move through various training programs overcoming employment barriers. And so far, we have uncovered that employment hope and perceived barriers, actually perceived barriers through employment hope contribute to economic self-sufficiency. So that's the current the up-to-date analysis that we have completed. And also we're finding that earlier stage employment hope change contributes positively, or increase in employment hope positively contributes to increase in economic self-sufficiency in later stage. So, those are the two main findings that we have uncovered so far. Just to give you the overall partnership, or the study design in terms of how we have put the data together, we have partnered with two HPOG organizations, Gateway Technical College and Southland Healthcare Forum. We have three comparison sites in year one of our study, and we have ended our data collection with them. First was Chicago Urban League, second Chicago Housing Authority, and the CARA program. The first one, the Chicago Urban League, is a hybrid program that emphasized soft skills development workshop in the beginning of their as they come into the program. And this is a placement-based program that does focus on the soft skill development. The third one, the CARE program, emphasizes heavily on the soft skills development. It has a very strong component for motivation, soft skills development, overcoming barriers, life strategies, and so forth, that create the environment for peer support to get people through job search and then placement and retention. Chicago Housing Authority was a work-first, placement-first approach. It was a summer program, summer jobs program for housing residents, and it was started with about 100 residents in the program for summer food program. We follow them over the course of four time points to look at their progress, and so these comparison sites become very useful in making comparisons with our career pathway model with HPOG organizations. And the data collection for us, we have our project coordinator who is at the Southland Healthcare Forum once a week, engaged in meetings and monitoring data collection activities at that site on a weekly basis. We have a data coordinator person who goes out to all 4 campuses of Gateway Technical College with the help of a contracted consultant, and we now have someone who's a graduate student who will be replacing that consultant, who will be going out on a weekly basis to monitor data collection at those sites. It is difficult when you're following individuals that are in various classrooms going through different curriculum across 4 campuses of the Gateway and the Prairie State Community College at Southland. It's very difficult to coordinate that, but these 2 individuals have been instrumental in putting together a plan, following these individuals, partnering very closely with program site specialists. And the other sites that we are doing comparisons with, they're rather a cohort model that move together through these programs. So it is rather easier, especially with the help of the staff who have been very instrumental in collecting the data. Our resources were rather short in terms of going out to all the sites we focused primarily on the HPOC sites. Other comparison sites, we work very closely with the staff to collect data. And just to give you a quick sort of snapshot of the PRS data, that is the data, the performance reporting system data that that all HPOC partners, 32 partners, have to report to, and the Urban Institute manages its data. And we have recently been given authorization to use the PRS data to combine with our survey data to look at individual student supportive services and other kinds of demographic data that we wanted to combine with, just to make sure that our survey data is consistent with the administrative data, and also the additional data that we acquire from PRS also helps us to keep understand the nature of their program participation. So the breakdown of the data that we have, 2,240 from Gateway, 76 from Southland, and the Will County is one that is just recently joining our research. So that is another HPOC program that only has about 10 students that we will be looking at. The total 326 individuals. Just to give you a quick demographics, we have more than half of our participants were African Americans, a great majority never married with dependent children, and a great majority earning less than $15,000 in annual income. And the distribution of service public benefit received, 66% receiving SNAP, 55% Medicaid. And just to walk you through some of the challenges and lessons learned. We, in partnering with these organizations, it has been a challenge to find individuals at multiple and different programs and campuses, and that has been overcome through the work of our data coordinator and project coordinator in very close connection with our project or program specialist at each site. And also, some of the programs, we find students going from a short-term program and then staying on to go on to the next level program. So they're not exactly exiting the program at the time when we think that they might be done. So there's difference in the length of programs for some students that they stay on, and because we are following individuals 4 times to do our surveys. In the beginning of the program, middle of the program, at the end of the program, and 6 months after, in staying consistent with the way in which PRS data is collected, so we can merge the data and analyze it as part of the multi-pronged approach to evaluation. And also, and we have run into the program sites when they were first starting up. They had some, they were still figuring out how to manage their students, and that's when we had some issues in the beginning. We were able to overcome that now with a very strong data collection schedule that we put together with our staff at each site. And there's also a lag time in PRS PRS data entry by each HPOC site, where we wanted to try combining the data, but the data that we wanted for the people that we have in our system are not entered in yet in the PRS system. So that creates a lag in our analysis. Just a quick glance at what we look at, 3 time points. These are we have yet to find 4th time points for people who graduated 6 months after post-graduation. We would find such fluctuation in employment hope if you see the first column. And then the second one, you would compare sort of the employment barriers in the bottom, the orange line, dipping and then going up again for Gateway. and self-sufficiency sort of going up and then dropping, and then increasing, you see self-esteem gradually. That compares to the total. If you see the right-hand column, that's a total average. So how we would compare how Gateway performs in comparison to total average fluctuation. So this is only a trend analysis, so we're just learning as we are developing a stronger database. And so basically, as mentioned earlier, we are learning that employment hope change in the beginning, in the first 2 time points, contribute to the self-sufficiency change from time 2 to time 3. And we're talking to our HPOC partners to learn to what extent, at least we learned anecdotally, that the program manager and specialists engage in intensive coaching towards the end of the program, where you have seen a little bit of continued increase in employment hope for Gateway. And so based on that, we have yet to find out through PRS, merging of the PRS data, to what extent our data empirically supports the anecdotal evidence that is being shared by our program specialists, that their contribution on the coaching, the intensive coaching, really helps individual students improve their psychological self-sufficiency that may have an impact on long-term economic self-sufficiency. So we want to use the PRS data to look at the extent to which they participate. They have received supportive services, and especially in the counseling area or coaching, and see whether those will have any bearing on the long-term outcome of economic self-sufficiency. What we conclude as our added value of this partnership is that we're looking at something that is intangible, that is psychological self-sufficiency that is not easily measured, and that is oftentimes considered touchy-feely, and that is not therefore not seen as something to be deliberate about in terms of providing services. While we do provide these services, there's not a process measure of such sort to look at what is in the black box when you have the input and the output and the outcome. What happens in that time when these things are all put in place? So that's what we're looking at together with these partners. And so we want to see to what extent some of the inputs, such as coaching, that leads one to develop hope and resilience, that is very deliberate, yet not measured, and manifested in the ways that we're looking at psychological self-sufficiency, how that long-term turns into or affects economic self-sufficiency. We propose that using PSS, or psychological self-sufficiency, as an intermediate benchmark of workforce development success, based on the theory of change, as we had presented earlier. And also what the added value, as we look at the multi-pronged approach to evaluation, we are working closely with HPOC partners to look at how each data from each site compare with the national HPOC evaluation, and also comparison with other HPOC sites within our study. We have multiple sites, so we can compare Southland with Gateway. And also within each site, we have students going through different tracks, career tracks within healthcare. So one supposedly leading to higher income versus one that is leading to very relatively lower income. Would that have an impact on how one is motivated and develop their employment hope to overcome their barriers? And how would they engage in receiving or seeking supportive services to in terms of reaching their economic outcomes? And also in making comparisons with the non-HPOC sites, the data that we are now very close to finalizing or cleaning up to do these comparison analyses. Those would be the 4 dimensions of partnerships that we are that's the added value of our partnership. So I'd like to end there. Thank you very much for your attention.
Thank you, Dr. Hahn. At this time, we would like to transition to our question and answer period. We've had quite a few great questions submitted, and I'll begin by posing the first one to you, Hillary. How big is the HPOG program in terms of total dollars spent on program services each calendar year and in terms of number of participants?
Sure. So ACF provides about $67 million in total each year across the grantees. And HPOG is expected to serve around 30,000 to 35,000 individuals over the 5-year period of the grants. And as I had mentioned in my earlier remarks, the grantees really do vary in terms of their enrollment goals across the 5 years, which in turn means that they vary in terms of the amount of funding that they receive per year.
Great. Thank you, Hillary.
Sure.
And as we move on through other questions, everyone on the line and the webinar, please continue to submit your questions through the question and answer box. So this is a question for both Janet and Philip. What are some things that have facilitated an effective, mutually beneficial partnership with your program partner?
This is Janet. I think that one of the things that's been really important is having regular communication, both by phone and in direct meetings. So we have a regularly scheduled monthly phone call, but we also participate in a lot of the meetings that they hold to keep their program going and then set up times to meet before and after those. So there's a lot of communication that takes place, and I think that that's been really important to keep us up on the program and not waste their time in filling us in, and for us as we're uncovering material from the interviews that we've been conducting to sort of test out what we've been finding with them. So that communication has been a really important piece of it. And then I think the second big thing has been being at meetings with their partners and with their program operators so that people have come to know us, and it's been a more effective way for sharing a lot of the information.
Thank you, Janet. Those are some great tips. Philip, do you have any thoughts you'd like to share?
Yes, I'd like to echo the part about consistent communication. We've benefited much by having a strong presence at each site with our project coordinator and data coordinator stationed there once a week and having sort of an ongoing relationship with our program specialists at each site, HPOC site. And also we have an ongoing meeting where we would put together a presentation on the findings that are up to date from our research, and we go to each site to do the presentation, and we do it every 6 months for one in the spring and one in the fall, and we are scheduled to go out at the end of this month. So that has been really helpful, and that's where we really get into a very deep discussion about how the common understanding of the theory of change is really unfolding in our collaborative research. And also the second part, it's really, I think, as I mentioned in the pre-presentation, that there's a common understanding of the core mission or the buy-in of the idea of the theory, based on the theory of change. And that's really key as we learn, as we understand that that the research is informing practice, and practice is also informing research, and there's a mutual learning process here that I think is really key, so that we continue to see each other as partners, and not just for finding our own benefits each, but mutual benefit as we have presented to you. Also, third is each agency, as we had been in multiple discussions with, mentioned that that their presentation of their success outcomes when they report to their funders have, in most part, been very descriptive, and also, to some extent, they highlight some success narratives of like some students who did, who overcame a huge amount of debt and also multiple barriers to reach some success. And those kinds of stories have really made an impact. Now with the need by the agency of these organizations to put the numbers to these stories in terms of the strength, inner strength, psychological empowerment, and such that we've been calling it soft skills or non-cognitive skills or whatnot. These things were really key in terms of us being a partner to our HPOC partners. So that those three I could think of as the key pieces that contribute to that help an effective, mutually beneficial partnership.
Great, thank you, Philip. Hillary, we have a question for you. Is there life after the 5-year sunset of HPOC? What sustainability efforts are being considered?
Sure. So there are currently some discussions and talks about reauthorization for the HPOG program. At this point, we don't know where that will lead or what will happen, but we do obviously see the research portfolio that we're supporting as feeding into those discussions, and hopefully we will all know more soon.
Hillary, can I just add a different angle on that as well, which is
Sure.
that there are these 5 research initiatives, and today we're just highlighting 2 of them, but it seems to me that all of our projects are really designed to embed a new way of thinking and practice in the communities where we're doing the research. And so, another angle on the sustainability is that ideally some of what we're learning through research is really going to be carried on in these different communities where it's being located.
Thank you, Janet. We have another question for Philip. Could you give an example of one or more specific strategies or approaches that program staff use to help improve psychological outcomes among program participants?
Absolutely. I'll give you an example of our Gateway partner, HPOC partner. And the staff who are program specialists, they are required to meet with their students once a month and to make sure that they're doing well, just checking in on them. And there's a lot of sort of the ongoing communication that takes place with the program specialists. They're not hired to do the direct counseling, but they are to engage the students to get information from them, especially for how they're progressing in each class and their planning for the next semester and so forth. And but we have been consistently hearing that these program specialists engage in and sort of a really intensive coaching that is not systematic in any way as part of the HPOC program. It is something that they do, they feel that they have to do because they're passionate about student success, but it is not measured alongside with the key input that is part of the HPOC or HPOC program. So those coaching, such as one where they would look at various barriers that one would see as barriers and sit with the students, they would say that why are these barriers to you, and just cognitively helping them understand the extent to which why they're barriers, and also looking at these goals that they have set for themselves, and they really help them do life planning and strategizing in ways that they can overcome these. In that process, they help individuals do this, what we're trying to call it, a process of mental contrasting. They look at what is negative and transform that into a positive, And with that positive or just overcoming or being larger than the negative, they would then develop that as their power, inner power, to move to the next level, continue on this sort of path toward their goals within this career pathways. So we've heard those narratives in many, many instances, and how they would do that while doing other work. They would run into a student who just happened to be in the hallway. They would sit with them for an hour doing this type of planning and helping them out with strategizing, overcoming their barriers, and giving them what we're calling employment hope here, but it may be termed different things by different people, but we're just using that as a way to connect with different agencies, especially our HPOC partners. Those are things that we are learning, but there are different components of this this measure, but we don't have data in terms of the extent to which those different components are activated when they engage these students with these coaching, what we're calling coaching, but it's a broad term. But we don't know exactly what takes place yet, but there's something happening with that. So that's what we're understanding so far.
Thank you very much, Philip. We have a question for you, Dr. Bogaswa. Assuming the program and stakeholders do not always have the same opinion and research priorities, how do you balance and prioritize their requests?
Great question. Because I think this happens more often than not, that people don't have the same research priorities, or they don't know how to make them actionable with the same level of priority. So I think there's a few things that we've done. One is try to break out some of our findings into short-term and long-term strategies so that we can make visible some of the data and some of the approaches that people might feel are sort of the low-hanging fruit that helps them move things forward, and putting on a back burner some of the larger ones or bigger ones that might take more organizational change and effect. So I'll give you an example of some of the of a shorter term kind of discussion would be looking at this issue of job descriptions and having conversations with employers through the HPOP business advisory councils about how job descriptions are written and how they can be broadened to value the diversity within the community a little bit more broadly and open up the HR managers' views of what might actually be of value, and putting examples of these differences of job descriptions in front of them might be able to change things up in a way that makes it easier for them to go back to their organizations and start putting some things into practice. Other kinds of changes are bigger. So we can put diversity mission statements and show to them and bring people in who are using them and have them talk about how these statements are helping shape their workforce and helping them shift some of the organizational practices. But those are the kinds of things that they'll have to go back and talk within their organizations about taking something like that on, and it will sort of take longer time to bring about. Another thing we do is we share our data with different kinds of employer advisory groups regularly and take their feedback. So in one instance, we shared a lot of data, and someone gave us the feedback that they wanted things much more specific about organizational practices that were not just New Hampshire-based. They wanted to see different kinds of data about how diversity would affect their bottom line. So it sent us back to do more detailed work to bring back, and now what we're working on are some sector reports so that we can report in a more focused way on how diversity would help the hospital sectors, how it might help home health care, how it might help long-term care, community health centers. And so we're trying to respond to their engagement around the need for more information. So some of it's formal and some of it's informal.
Great, thank you, Dr. Boguslaw. That was very informative. We have another question for Dr. Hong. When conducting your research, what baseline was used to determine the population of low-income individuals? Was there a group of individuals who may not qualify due to their income being too high, but still living near the poverty level?
A great question. For the purpose of our study, the first 2 years of data collection has primarily been anyone who comes into the HPOG program who, by definition, as we understand, are low income. And we did not look at the actual income level because that would require us to merge the data with our PRS system to actually look at if someone were rather comparatively higher income while being low income, but relatively low income, higher income compared to others. So that would be a good way to divide up the groups into the ones that are really in the lower range versus those that are in the higher range to see if there might be any different impact. We have not done that yet. And most organizations that we have used to collaborate with also serve very low income that have been formerly homeless or formerly convicted who are coming back into the society. So most of them do not have jobs currently to have any income. So it would be rather those that are in extreme poverty compared to just below the poverty line. So currently we did not divide up the groups, but that would be a good way, particularly if someone is just been who have a longer work history, who is currently unemployed, going through some of these programs to get back into the workforce versus those people who have been chronically unemployed for, then we would need to parse out the differences, and that's a great suggestion. Thank you.
And this is Hillary. I'll just chime in to say that the HPOG program overall targets TANF recipients and other low-income individuals, and each grantee is allowed to define low income as appropriate for their communities in collaboration with the ACF program office. And so most of the grantees define low income based on the HHS federal poverty line. But again, they do really look at their communities that they're serving and the local labor markets there to determine that in conjunction with the program office.
Thank you, Hillary and Dr. Hong. One more question for both you, Dr. Hong, and you, Dr. Boguslaw. You talked a little bit about how you share interim research findings with your program partners. Do you have any advice regarding how to effectively and accurately frame the interim research findings to help your program partners understand that they're not yet final research findings?
Well, I think that what's really important in the kind of project that we're engaged in is to make all the different stakeholders feel that they're partners with you in the research, not just our primary HPOP partner. So what we've tried to do is frame the findings in ways that will be most meaningful to different audiences as the initial introduction of data. So when we work with the workforce training providers and the community colleges, we put our findings about workforce development up front, and then we sort of make some of our findings about the employer organizational changes secondary. With the employers, we put the employer pieces up front. With other stakeholders in the community, even with community leaders who we want to engage in this work, we talk a lot more from the data that we've gathered, talking to community leaders about how they're involved in moving healthcare jobs and reducing healthcare disparities forward. So I think that one piece of it is really knowing your audience and bringing them into the data that's been developed and having them help make sense of it with you. And therefore, we're not gathering data and imposing it or our analysis on them. We're working with them to build an analysis and then taking all of the different pieces together to build sort of an overarching analysis of where things are going. The other thing I'd say is that in developing the research, when we were initially thinking about this, I think we weren't always clear about how broad a range of stakeholders we might encounter who would be interested in this work and who would have different lenses that we would want to include and whose lenses would help provide information. So, we didn't start this out as a workforce, focusing so much on the workforce, but we did do interviews with some of the healthcare trainees and people who are working in the healthcare field, both minority and non-minority. And they told us a lot about what they thought was going on and what they thought would be valuable in helping make change. And so they've also become an important constituency in vetting some of the ideas about organizational change in the workplace. So I'd say that that's the, broadly bringing each of those different pieces and groups together individually as groups at first, and now we have a report that's coming out soon and a series of other reports that will look at some of these different strategies pretty much by these different interest groups, and hopefully we'll be bringing all of them together to talk about it as a broader strategy with OMRA taking the lead on that.
And I may add that our approach has been that we share with our community partners that all research is tentative to begin with. There's nothing that research is going to say definitively, that we are a community of co-learners with our partners, that we are in there working with them to generate data, to understand the phenomenon together, and the perspective that we may bring may be lacking that would be complemented or helped out by our partners to understand better with their set of eyes. So we come in to the community providing our presentations and analyses, saying that this is tentative, this is an ongoing analysis, and anything that they would ask us to look at, not as if we would have any agenda, but it would be their agenda that we would be very interested in learning from, that would, that inform our research, like practice inform research. That full feedback loop is very important for us, and they understand that. And one of the things that is emerging from that, those discussions, is a series of focus group interviews that we will conduct this year with our current students and graduates and staff. And one site asked us to talk to their employers and see how they value the training and credentials that come out of the training of the students that graduate from their particular program, and also how much they value if they were to look at the soft skills or psychological empowerment component. To what extent that they see that as comparable, complementary, or as key to hiring these individuals and having them stay in those jobs. So these and so we are talking to our partners in ways that could help us improve our research program to look at the same phenomenon that we're looking at, that economic self-sufficiency as a long-term outcome, but the process of change that one undergoes as they take on this challenge of being part of the long-term program to be in healthcare sector as job seekers and hopefully in the future as workers. So it's been a great partnership in that way to learn from our community partners.
Thank you, Dr. Hong, and thank you again to all of our presenters. At this time, we will conclude the webinar. A recording of the presentation, slides, a transcript, and the question and answers from the webinar will be posted to the Self-Sufficiency Research Clearinghouse in the coming weeks, and a notification will be sent out to you alerting you that these materials were posted. In addition, when we end the meeting, a webinar assessment will appear in your web browser. Please take a few moments to respond to help us improve future webinars. As a reminder, all of your responses are anonymous, and it really helps us plan for our future webinars. Thank you again, everyone, for joining. Have a wonderful afternoon.